I'm Dr. Jonathan Clark, and this is an example of our computerized device called non-surgical spinal decompression. This table and this device is very effective in patients for patients that have chronic pain. And you may be one of those people that have the chronic back pain, the herniated disc, the sciatica, the nagging pain. You can't sit, you can't move, you can't walk. Spinal stenosis. This helps this in a very conservative fashion. Up till now, what are your options when you have these things going on? Well, your options are medication, or possibly even injections, which we know from the literature is more or less just an expensive Band-Aid. You may go to physical therapy, which can be effective sometimes, but oftentimes it can even make the problem worse if the patient's inflamed. I'll see that with a patient has a herniated disc. Sometimes they're inflamed and moving more actually can aggravate it. Or possibly even surgery, which you know from many friends or coworkers can be unsuccessful as well. So this device helps those kind of conditions in a non-surgical way. You can see we've got the belt wrapped around me here, which helps distract the lower part of the pelvis and really focus on that lumbar region. And we can change the angles accordingly depending on where the actual injury is. Patients can be treated face up, face down. How about the success rate? Well, it's very successful. Research has said that it's about 86% successful for herniated and bulging discs. And in fact, the Journal of Neuroscience actually stated a few years ago that any individual considering surgery should undergo this first before there's permanent alterations made to the spine. So those two things in itself, and the clinical experience we've seen here, it does very well for chronic pain issues. But the key is not just getting out of pain, although that's great, but we want to focus on getting it to stabilize and heal and then rehabilitate, which is why we use a lot of functional rehabilitative exercises in our office once you're ready for those things, along with ancillary procedures we can use in addition to get that pain down, such as high-powered laser and pulsed electromagnetic frequency. So there's many things we do in our office to help herniated and bulging discs. This is one of them that proves very successful. And it's just another example of something we use in our office to get you better, faster.